The World Health Organization now says the coronavirus can be airborne and linger in indoor spaces. The agency previously said that was unlikely. Over 200 scientists urged the WHO to revise its position based on new scientific and anecdotal evidence. The agency has also strengthened its position on asymptomatic transmission, saying it's more common than previously thought. Infectious disease expert Dr. Amesh Adalja joins me now. He's a senior scholar at Johns Hopkins University, Bloomberg School of Public Health. Dr. Adalja, thanks very much for being with us. A lot of people are looking for clarity on this issue, so I'm really glad that we have your expertise. First of all, if the virus is airborne, what new precautions do people actually need to take to protect themselves and people around them?
This is a complicated matter, and I think that there's a little bit of misconception going on. So when you think about infectious diseases, some of them that spread through the respiratory route are through droplets, where you're in close contact with each other. And these are large droplets that fall to the ground within about 6 feet. And this is what influenza does. Then on the other end of the scale, there's something like measles, where it is airborne, and someone who walks into an elevator where someone with measles had been 30 minutes prior can get infected. That's what we classically thought about as airborne. What we're seeing is that there may be kind of a middle way in between these types of transmission, and this coronavirus may have that. But it doesn't change the way we prepare for it, because we have many healthcare workers that are taking care of patients that are not using the same precautions that we would use for measles, and they're not getting infected. So I don't think that this changes what the public needs to do. This is sort of becoming a debate between infectious disease doctors and aerobiologists, but I think it's getting a little bit confused in the public about what we do. I don't think that there's going to be any major change in how we deal with this virus coming in the future based on this type of data that's emerging.
So wearing a mask, socially distancing, making sure we wash our hands, those are all things people obviously should continue to do, it sounds like.
Right, and airborne transmission is important in hospital settings where aerosol-generating procedures may be going on, like bronchoscopy or intubation. But in everyday life, I don't think that this really is going to change what we know about transmission dynamics.
Nevertheless, folks might be wondering, how long is the coronavirus believed to linger in the air, and what types of spaces are the most risky when it comes to this airborne transmission?
So it depends upon the conditions that you're in, but what we're worrying about when you think about it lingering in the air, it's going to be in places that are poorly ventilated, that are obviously indoor, and it could be minutes or so that it may linger. Maybe up to an hour in certain situations, but I don't know that this is really going to pose a transmission risk, because we haven't, if you look at the data, it doesn't actually show that they can specifically say that this was airborne transmission that occurred and not droplet or not somebody touching a common touch surface. So I do think there's still a lot of science and uncertainty before we can kind of change the way we think about how this transmits in the guidance that we give to the public.
Do we know enough to answer the question, how does the risk of airborne transmission compare to the risk of catching the virus through direct contact?
Direct contact is the main way that we see people getting infected. People that are within 6 feet of each other for 10 to 15 minutes, that's where we're seeing people transmit. We're not, like I said, even if you read the new WHO guidance, it's really unclear to me that they've actually established that airborne transmission has been definitively established in settings where we can't, because you can't necessarily rule out that there was close contact or a droplet or a common touch surface. So this, again, is going to be something that's very confusing for the general public, because it is turning into a little bit of an academic debate.
Let's talk about this idea of asymptomatic transmission. First of all, what does that mean exactly? And what are some other ways that people who are asymptomatic can be spreading the virus?
So asymptomatic transmission refers to transmission of the virus from somebody who doesn't have symptoms. Now, this also is something that's very controversial, because there's been a lot of back and forth about what asymptomatic transmission means, what pre-symptomatic transmission means. That means people that are going to get symptoms but don't yet have them. And then there's people with very mild symptoms that aren't even really attributable to the coronavirus in most people's minds. Like they might have aches and pains and think that they're from working out or something, but it's really the coronavirus. So what we're finding is that in certain situations, those individuals can transmit, and that poses a risk because they don't know that they're infected. They don't know that they're sick. And that's why we recommend people wear face coverings, because we don't know if their symptoms are contagious. We don't know if they're actually contagious to people or not, and they don't know if they're contagious to people or not. So we prophylactically ask people to wear those masks, and that's what we've been seeing throughout this pandemic, these people that are pre-symptomatic likely can transmit in certain contexts.
What are those contexts? Because, people are going to wonder, well, if that's the case, they obviously want to take the proper precautions if there is a concern that they could be pre or asymptomatic.
So that's one of the important research questions that is still outstanding. We don't really know the full context of pre-symptomatic transmission. We've seen it happen, for example, in close household contacts. People that are working together have transmitted that way, but we don't know everything that governs that type of transmission, and that's why we have to be on alert, and that's why you see these recommendations that people wear face coverings in public, that they try to remain 6 feet apart. It's because of this whole phenomenon, and it's still something that we need to completely unravel.
So the World Health Organization previously said that asymptomatic transmission was, quote, very rare. Now it says it may be more common than previously believed. What evidence, doctor, prompted the agency to change that view?
What we've seen is multiple case reports, multiple studies looking at outbreaks and trying to understand when people became symptomatic and when transmission might have occurred. And it's been a lot of data that's accumulated over time that's gotten the WHO to kind of change. And you have to remember that this is the 7th human coronavirus that we discovered. And for all of the other ones, we don't really have this phenomenon. So if you just look at the biological characteristics of the viral family, this wasn't something that we had seen with other coronaviruses. So there was good reason to believe that this wasn't common with this coronavirus. But it's still, we don't know. If you read the WHO guidance, they don't talk about how common it is or how much it's actually leading to the trajectory of these outbreaks. So again, this is something that's all being learned in real time. So you can expect to see shifting guidance and shifting knowledge as we move through the pandemic.
Is that why it took a little while for the WHO to revise its position on that? Because they're still obviously trying to get their arms around what exactly this coronavirus is. Is that why it took so long to revise the position on asymptomatic transmission?
Exactly. You wouldn't expect the WHO to move guidance just based on a couple of anecdotes. They needed to have, a preponderance of evidence to change what we knew about this. And we know that anecdotes don't necessarily equal science. So you have to have enough data to be able to actually come up with a firm position. And I think that's what happened. This is how science works. Things don't change overnight. You need to have some actual data that accumulates over time to be able to overturn another hypothesis.
Right. People are looking for some immediate answers, and the reality is that it does take time to actually get that kind of database of information compiled. All right, Dr. Amesh Adalja, thanks very much for sharing your insight and perspective with us. It's been really valuable. We appreciate it. Thank you.
Thank you.